Good morning. Remember, breathe, relax, check for symptoms of dry cough, fever, shortness of breath, fever being 100.4, shortness of breath not being able to check your symptoms. If you have a pulse oximeter, remember to use it and watch for trends in decreasing, especially if it gets below 94%. Check on your family members and the one you love, and of course, check on each other. Remember, physically distant, but socially together and supportive. I want to step back now. There's a term that's going around, you're hearing a lot about, it's called cytokine storm, but let me put it in real terms. If you've experienced the COVID-19 virus, positive infection, or know someone, or you've heard it on the news, there are patients that are doing fine, seem like they're doing absolutely fine until about day 10, day 14, and all of a sudden it seems like they're getting better, and then boom, they crash. It's what's called a cytokine storm. I've defined the term cytokines. They're cells that are part of the immune system and they signal other parts to act and help the body out. A cytokine storm is when you have an overproduction of cells in the immune system and those activating compounds, the signaling compounds like cytokines, and it's triggered often by something like the flu, or in this case, like COVID-19. It's a surge of immune cells, particularly to the lungs, that result in the inflammation in the lungs and the fluid buildup, and it can lead to more respiratory distress and potentially contamination with a secondary bacterial infection. In other words, it can make you really, really sick. It increases the mortality of patients, and again, like I mentioned before, it can happen with the flu. But what happens is your immune system just overreacts to the virus, and as a consequence of the overreaction, the damage to the other cells, particularly the lungs in this instance, can be fatal. So things will be going fine, and then all of a sudden, and it's an individual response. It's not really predictable, and that's what they're finding across the country. It never has been predictable, but what they're finding is it's hard to predict who this will happen to and who it won't, which is why it's imperative that we stay on top of our health. There's an article talking about cytokine storm. There's a definition up top. Remember to check your self-checker. The best thing we can do for ourselves, of course, is breathe and relax, decrease our stress, check on our symptoms, check on ourselves every day. We want to check our temperature. We want to check our blood pressure. We want to check our pulse ox if we have one. We want to monitor our symptoms and treat them over the counter if you're at home as best we can until things get dire and you have to call your provider. Your provider might ask that you go to the hospital for supplemental oxygenation. But in the meantime, we want you to be on top. You need to be the expert on your health. If you don't have the disease, if you have recovered, we want you to get checked, check your symptoms, check your vitals, check and take your normal blood pressure medications, health education. If you have any questions about anything, please ask me and I will try to do my best to answer and keep you updated. Get fit, eating healthy foods is always what we want to do. And of course, find time to exercise. Practice social distancing when you exercise. And again, breathe, check, step back. Now let's go. It's a beautiful day outside. Let's go get checked, get fit, get moving. I'm with you. We got this.